Hi, I'm Lacey Cam at Oregon State University, Carlson College of Veterinary Medicine. We will be discussing equine skin grafting using the punch technique. The first step in wound grafting is to assess the wound and assure you have a healthy bed of granulation tissue to work with. Diseased tissue or highly infected tissue must be treated prior to grafting. This particular horse had this injury for over 6 months. It was non-healing and it involved the extensor tendon. The next step to complete a punch graft is to remove the excess granulation tissue from the wound. Granulation tissue contains no nerves, so trimming this tissue usually does not require a nerve block. A tourniquet can be used to decrease hemorrhage if needed. Sedate the horse, trim the tissue back using a blade and a thumb forceps. Start at the distal aspect of the tissue and trim the granulation back to the level of the epithelium. Excessive hemorrhage can push your grafts out of the wound bed, so horses must be bandaged after trimming the granulation tissue. I pressure bandage my cases overnight prior to grafting. The tools required for grafting are listed here. I use a 6mm biopsy punch and an 8mm biopsy punch. Punches need to be new, sterile punches and must be very sharp to perform the procedure. I prefer to use brown adze and forceps, and several other tools required are listed here as well. We then prepare the donor site by sedating the horse, clipping, and sterilely preparing the area. We use local anesthetic to anesthetize the area. This horse has some muscle fasciculations, so we repeated our nerve block. The site we chose for donation is usually an area that's away from visualization, as some scarring can occur with the taking of these grafts. Ideally, the color of the donor site should match the recipient bed, though this is not the case in this horse. Use the 8mm biopsy punch and use pressure while rotating the hand and take the punch from the epithelium. Then use the thumb forceps to pull the graft from the site. Place the graft on saline-soaked gauze, making sure that they stay moist throughout the procedure. I usually do 4 or 5 grafts at a time before proceeding to the next steps, and then I come back to perform more grafts later on. The next step involves removing the subcutaneous tissue from the epithelial layer. Gently hold the epithelium with a forceps and use a sharp, fresh blade to trim away the subcutaneous tissue. The subcutaneous tissue is going to prevent vascularization of the graft, so it needs to be removed. After I've trimmed it, I place it on another saline-soaked gauze. In order to place the grafts in the bed, use the 6mm biopsy punch. We use a smaller punch so that the 8mm biopsies fit snugly into the recipient site. Rotate the punch to not quite its full depth so that our grafts don't get buried in the granulation tissue. Start at the distal aspect of the wound, as hemorrhage will prevent visualization. Hold on to the graft with the thumb forceps and place the graft into the wound, making sure to place the graft of the subcutaneous layer lying into the horse and the epithelial layer at the surface. I use my cotton tip applicator to decrease hemorrhage in the recipient bed and also to help push these grafts into the bed. You will attempt to align the hair in the proper direction during this time. This horse is not nerve blocked here, so he will feel some sensation at the edges of the wound bed. You can nerve block these horses or place the grafts further from the wound edges if needed. Place your grafts with approximately 5mm of granulation tissue between grafts. Approximately 80% of these punches should survive. Once you're done grafting, clean the graft recipient site gently with saline and gauze. Press any grafts that are excessively protruding from the surface back into the bed with a cotton tip applicator. Clean the donor site with sterile gauze and saline. The donor sites can be sutured or left open to heal. Now place a non-adherent bandage onto the lower limb. A non-adherent dressing is critical to prevent these grafts from being pulled out upon removal of the bandage. The non-adherent bandage can be secured using roll gauze and loosely placed adhesive bandage, followed by a standing bandage. Owners are advised to change the bandage in 7 days. I give the owners a bottle of saline so that the bandage, if it's sticking to the grafts, they can use that to gently free the bandage from the graft site. Then they should keep the limb bandaged with regular bandage changes until it's fully epithelialized. And this is our wound 5 weeks later, completely epithelialized with that bay hair covering the site. This completes our tutorial on punch grafting. Thank you.